Hi guys, Ryan here from Advanced Physical and Aquatic Therapy, hashtag Advance Your Health Video Project. It's Friday, so today we're going to tackle Ask a PT Friday. The question for today is, what would you suggest for tight IT band and or hips? So a little bit to unpack in that question. First of all, is it your IT band that is truly the cause? Because the IT band is basically like a thick I-beam that goes down into your femur of tissue that doesn't really get mobilized very easily. So what we need to think about is the pain down near your knee? That's true IT band syndrome on the lateral side of your knee. If it's here in the mid part or even up in your hip itself, I would say that's not IT band, but either way we can address this issue, because I think what's going on here is some sort of hip issue with some lack of glute firing or glute strength. Because as our lives, we sit all day, we sit at a desk, we sit in a chair, we sit in our car, it tends to inhibit our glutes, so meaning that our glute muscles do not want to fire. So first let's tackle the mobilization part of things. We're going to grab a foam roller, and we're not mobilizing your IT band, we're mobilizing the structures anterior, which is your anterior lateral quad, and posterior, which is your lateral posterior hamstring. So we're going to first start off just around the bony part of your hip. We're going to angle our body about 45 degrees towards the ceiling, and we're going to roll all the way from the knee up to the bony part of the hip. You're going to spend 2 minutes like this. If you find an area that's a little more tender, you want to tenderize that area and basically spend a little more time on that. 2 minutes total that side. Then you're going to angle 45 degrees down towards the ground. Start at your hip and go all the way to your knee. Now I feel some tenderness right at the knee and a little bit above, so I'm going to hang out here and I'm going to spend 2 minutes this way. That's the mobilization part of it. Next is we're going to try to get those glutes to fire, so we're going to use a band. We're going to put that around our knees and we are going to lay down. We're going to lay down in a bridge position, and what I like to do is use this single leg so we can't cheat. So we're going to keep our stomach muscles tight. We're going to lift one leg up. We're going to try to keep some tension on the band outward, and we're going to raise our hips up to the sky. We're going to do 10, and then we're going to switch legs. And we're going to do 10 more until we get 30 on both sides. And last but not least, we are going to activate our glutes in a more dynamic position. So we're going to head over here and use a wall or a physio ball. So follow me over here. We have a physio ball against the wall, or you can just use the wall itself. I'm going to use the physio ball. And you're basically going to put pressure into the ball or the wall laterally, trying to engage your glutes. And we are going to do a mini squat while pressing outward, trying to spread the floor with our outside foot. 10 one way, and then we're going to go 10 the other way. 10 until we hit 30 on both sides. I hope that helps. Anybody out there with some IT band pain or just tight hips in general and underactive glutes? Until next Friday, thank you very much, guys.